A team at Warwick Medical School is carrying out the UK's biggest ever clinical trial in orthopaedics to discover the best way to treat a heel bone fracture. At the moment, these foot fractures are either treated with an operation or left to heal naturally, but doctors don't know which is best. The trial should ensure that every patient has the best form of treatment.
Every year in this country, 2,000 people suffer severe heel injuries as a result of crushing or fracturing, either in road accidents or falling off ladders. In the worst cases, it can lead to arthritis or deformed feet, and some people are never able to work again. But now, as a result of a £500,000 clinical trial, surgeons, together with academics at the University of Warwick, are trying to find out what is the best way of dealing with this injury. The clinical research team are not only studying X-rays and CT scans of heel fractures, but also collating the response of other surgeons. The question is simple: is such an injury better allowed to heal naturally or through surgery?
I think the difficulty at the moment is we really don't know whether an operation is better than no operation. And that's the subject of this clinical study, to determine whether these people, the majority of people with these fractures, would be better treated with an operation or without an operation.
Damien Griffin has spent the past 18 months as a pioneer in the field, explaining to patients the options and what's wrong.
This is a plastic model of a foot and the lower leg. It's a right foot, so there's the big toe there and the little toe over here, and this is the heel. And the heel bone is this one just here. Its scientific name is the calcaneus or os calcis. But it's the heel bone, it's the one that you feel at the back of your foot and sits in the back of your shoe. And you can see that the heel bone joins onto the bones underneath the ankle here. And there's a very important joint just in there called the subtalar joint. And it's that joint which is very often involved in the injury. So when someone falls onto the ground and lands on their foot, they can crush the heel bone here, breaking it into lots of pieces, squashing it and broadening it, and also damaging the smooth surface of this joint in here. Now, during surgery, what we try to do is to open the skin just here, so we can get at the side of the heel bone, and then fit all the pieces of bone back together like a jigsaw puzzle, fix them then with screws and metal plates, and then close the skin back over the heel bone again. And that takes about 2 or 2.5 hours to do.
Mondays are theatre days for Professor Griffin and his team. Fractures of the heel can result in people never working again or being left with a deformed foot.
I just measured a piece of gutter on the priest's roof. It's only 12 foot up. Collapsible ladder, like a loft ladder. I put it up, I thought I'd clicked it in properly. It slipped and I come down.
67-year-old John Doran awaiting diagnosis on what treatment is best for him.
Once they looked at the scan, they'll be able to, I don't know how long these treatments are going to take then.
Well, arthritis in joints is mainly a wear and tear process. Sometimes it happens naturally as people get older, but of course if you have a bad injury to one of your joints, and that's what happens in a heel bone fracture, then you naturally have accelerated that wear and tear process. We think that if the pieces of bone are not correctly realigned, then that wear and tear happens faster still. So with surgery, although there's an initial injury at the time of the accident, if we can put everything back to form smooth surfaces, we believe we can slow down the progression to any arthritis in the future.
All cases spend 12 weeks on crutches and undergo physiotherapy. There is no shortcut.
Okay, not too bad? That's fine. Just going to move around.
When they first come in, getting them to start moving it. Obviously, if you've had the type of injury they've had, it's a massively traumatic injury, and it's not very nice to actually start getting that foot moving again. We'll see them 2 or 3 times a week, and we'll initially see them for about 20-30 minutes at a time, and that will continue through seeing them a couple of times a week up until discharge if needs be.
This is the largest clinical trial in orthopaedics ever undertaken, and it'll cost nearly £500,000. The team, led by Professor Damien Griffin, will assess both surgical and non-surgical cases of heel fracture after 6, 12, 18 months and finally after 2 years. the group trial leader does not know what the outcome is likely to be.
We need 150 patients with these sorts of fractures who will be divided evenly into having surgery or not having surgery. That's a lot of patients to find because although these are fairly common fractures, we need patients who've got just that particular sort of fracture where we are most uncertain as to whether operation or no operation is better. Some patients who have had their fractures heal naturally do come back to us, and then we have to do further surgery to correct that problem. And that often means fusing the joint underneath the ankle to take away pain that they have, especially when they're walking on uneven ground or up and down hills. We think that doing the operation in the first place might avoid the necessity for that sort of secondary surgery in many people. But as yet, we still don't know for certain.